So we discussed about the care service. In Japan, there is a long-term care insurance system, which is established in the 2020. Okay. So there are the three topics: the overview of care service, type of care service, and then care process. Okay. This is a brochure published by the Tokyo Metropolitan Government about long-term care insurance system. Look at here. The long-term care insurance system supports the independence of the elderly by establishing a community that guarantees people a secure life. So there is a key word, right? There is a key word. Irene-san, can you find the key word that I want you to mention?
Secure life.
Secure life, of course, secure life. And what else?
Support independence.
Good. Yes, supporting independence. Supporting independence. Okay. There are three principles of the Japanese style of caregiving. One is
Dignity.
dignity. Yes. Now, caregiving that maintains dignity. We respect the human right of the user. Okay. The second, supporting independence. Supporting independence. Okay. The number three is arranging living environment. And also there is another key word of this sentence, that is a community. Community. So I will explain why community is important. Okay. So from the overview of care service, there are two topics, two parts: how to use long-term care insurance and classification of health condition. Health condition. So if you are 65 years old above, regardless of the cause, regardless, we don't care what kind of disease you are suffering. If you are 65 years above, you can apply for long-term care insurance. You are eligible for the benefit of long-term care insurance. Or if you are 40 above, 40 to 64 years old, and suffering from specific disease below, specific disease like a cancer or osteoporosis or dementia, you can apply for long-term care insurance. If out of these disease, you can still use the medical national health insurance, because in Japan, everybody has a national health insurance. Okay, but after 40 years old with specific disease, you can apply for the long-term care insurance. Okay, there are two categories. Then how do you use long-term care insurance? How to apply? First, this. You visit the city hall or local municipality, the support center, you visit to apply for the long-term care insurance. Then after that, investigator will visit your house to interview about physical and mental condition, and also the family structure. They investigator check. That is a field survey. Then after field survey, initial screening and secondary screening conducted by the long-term care need certification committee composed of several specialists like social worker or nurse or sometimes a dietitian. So these specialists discussed about the care level. Okay. Then user will receive the notification of the result. Okay. Then based on the result, care manager will make care plan. Okay. Care manager is the one who make care plan. Okay. I will explain what kind of the care services. So later. Okay. Then according to care plan, user will start to use care services. That is a general procedure, how to use long-term care insurance. Okay, like this. So first, field survey, then initial or first and second judgment, first and second screening conducted by the healthcare, the certification committee. Then user will get the notification. Okay, then classification of health condition. There are three types. Actually, not three, but three categories. First, this one, not applicable. So even though the people apply for the long-term care insurance, but not applicable, which means that the user still okay, no need to use the long-term care insurance, so they can be independent. So in that case, even though in that case, people can use free activity for health development conducted by the local municipality or the local community to prevent a need of long-term care services. Okay, each local municipality has different free activity. Okay, then if you are qualified or if you are judged as a needed support level 1 or level 2, you can use the preventive care service like daycare service or um, home visiting service. Okay, to prevent long-term the need of long-term care service. Then if you are qualified or not qualified, if you are judged as a needed long-term care, needed care level 1 to level 5, then you can use these three services: home visiting care service, or daycare service, or facility care services. Okay, level 1 is it's a how can I say it? Less need. Then level 5 is severe cases. So if you are judged as a long-term care level 5, you you have the most volume of the service you can use. But level 1 is not so much to cover the insurance. So for the user who stay in the facility like a nursing home or the local, so most of them are level 3 to level 5. their jobs, their needed level. Okay. The next is a care service. Type of care service. Okay, type of care service. As I mentioned, there are three: home visiting care service, daycare service, and facility care service. Okay. So this is a part of the brochure that I mentioned from the Tokyo Metropolitan Government. So actually there are three categories. One, home care service, home-based service. Second is community-oriented service. So home care service is composed of the two services. One is home help service, home visiting care service, and day service, because user stay at the home. Okay. Then second one is a community-oriented service. The third one is a facility service. Okay, everybody already understand about the facility service, right? Facility service. How about community-oriented service? Do you have any idea about community-oriented service? Have you heard? Have you heard community-oriented service? Anybody? You can guess. You can guess based on the name. Community-oriented service. What is that? ID-san, can you guess?
Here in Philippines,
Mm,
for the senior citizen
mm,
or 60 years old above,
mm.
government provide them pension, something like that.
ペンションね。OK、ペンション。
If service, I know some facility service like in
へ
hospicio where I do my on the job training.
ー。I see, I see.
There are a lot of elderly.
Okay. So
But
actually, the community-oriented service is a new service. New service. So when the long-term care insurance system started, there is two services: the home care service and the facility care service. But now we have a community-oriented service. That is a new service, like this. So the concept of community-oriented service is to what can I say? To provide the service for the user to continuously live in their house or live in their community. Of course, everybody want to live in the community that you grow up, right? So, Rona-san, where is your province?
Actually, my province is in Cebu.
Cebu. Are you
Yes.
living in Cebu right now?
No, I'm here in Marikina.
Marikina. Okay.
Yes.
So which area you grow up? Marikina
In
or
no, in Cebu.
Cebu? Okay. So when you get old and you need to be cared, which area you want to live?
I prefer in Cebu
Cebu.
because my whole family is there.
Because the friend or family there.
Yes.
I see. Yes, it's a very understandable, right? Reasonable. So not only Rona-san, but also most of the people want to live in the familiar community because there are the family or there are the friends, there are the what can I say, the memorable, the restaurant or the place. So that's why the community-oriented service. So uh, we help the older people who need to be cared can stay at same community or their house as long as possible. As long as possible, because most of the Japanese doesn't want to stay at the facility. They want to live in their house. So, but unlike Philippines, so most of the Japanese, doesn't live together with their parents. I mean, the older people live alone or with the wife or husband in the house. So they cannot expect the family member to take care of themselves. So that's why they need someone instead of the family member to uh, to look after. Okay, so that's why the service from community-oriented service is like this: regular visit or on-call visiting care service. Because I understand that in the Philippines, usually the people hire the nurse or caregiver staying to support 24 hours because the personnel cost is less expensive than Japan. But if the Japanese hire the personal nurse or personal caregiver for 24 hours, maybe easy to go bankrupt. Very expensive, very expensive. So cannot. So that's why we have to use this kind of the government service, not the government service, the public service. So when you need care service, our care staff, so we call or periodically care worker visit the user's house or even at nighttime, because 24 hours the user needs support. And also home visit bathing service. Not every day, but maybe once a week or twice a week, they can use this kind of service. Sometimes the care provider will bring the portable bathtub. That time, so not only care worker, but also nurse will go together with the care worker. And also home visit nursing and home visit rehabilitation. Then healthcare guidance for in-home care. So they provide instruction about food or about the regular kind of the because uh, especially the oral care and nutrition diet diet. What kind of the food they should eat? That kind of the advice staff will provide. Okay. Then last one is care process. Okay. After using long-term care insurance, every year, every 12 months, you need to renew. That time, we certification, long-term care needs certification committee do assessment again to check the care service that the user is using right now is appropriate or not. Sometimes the care level going up, but sometimes going down. Okay. Then the certification committee discuss about the plan. Then implementation. Okay, do. Then after implementation, check the care service again. This is the procedure of care process. So we repeat the care process again and again to improve, to monitor the care service is appropriate. Okay? Even user living in the facility, they gonna renew every year to check. Okay? All right, let's discuss about this. What is the most attractive service in long-term care insurance for you? Okay, you already learned the several care services, right? Okay, let's discuss which one is the most attractive for you.